Ozempic and Mounjaro reliably work to create weight loss. But for them to really work, and I mean work long term, you will have to do more than just take your weekly injections. Hi, I'm Karen McIver, a registered dietitian that helps young and middle-aged adults reduce their risk of developing chronic diseases. If you care about your long-term health, this is the YouTube channel for you. Hit that subscribe button for weekly science-backed tips to help you feel your best. I'm going to talk about maximizing and maintaining your results if you are taking a weight loss medication. So tip number one is stay on the medication and use the most effective dose for you. Now, these weight loss medications are not meant to be short-term diet plans if you just want to lose a couple pounds for a vacation or a life milestone. They are meant to be taken for years to treat obesity and other chronic conditions. Now, study after study shows that when people stop taking their weight loss medications, they are likely to regain some or all of the weight that they initially lost. I also saw someone on social media ask an influencer if they should start microdosing semaglutide, and that influencer correctly said that there really is no research or evidence that supports taking a microdose or a small dose of these semaglutide medications in pursuit of any weight loss or health goals. Now, the recommendation from the drug makers and from doctors is to start on a low dose of these medications, but to move up to the therapeutic dose, the dose that was tested in clinical trials, because those are the doses that are going to actually produce results. So that leads me to my second tip, which is to manage the barriers that might cause you to come off of your medication early. The Cleveland Clinic looked at the results from 8,000 free living weight loss medication users. Free living just means they are regular people living in the everyday world, just like you or me, as opposed to the clinical trial results, which are just much more controlled. Now, this study found that these folks, the regular people who took their weight loss medications for 12 months, lost on average 11.9% of their original body weight. And that is a bit lower than the 15 to 20% that was seen in the clinical trials. However, they also found that folks who took their medication for 3 months or less lost only 3.6% of their original body weight, and folks who took their medication more than 3 months but less than 12 lost 6.8% of their original body weight. So that 3 to 7% is actually the exact range that we see in our existing weight loss programs. Things that are only changing lifestyle, what we eat and how we exercise. So what this tells us is that if you are going to be on this medication for less than a year, it is probably going to be a whole lot more expensive and just as effective to change your lifestyle rather than take these medications. Now, the leading reasons that people came off of their weight loss medications early were side effects or symptoms, cost of the drug, and supply disruptions. The side effects most commonly cited by weight loss medication users are nausea, vomiting, diarrhea, constipation, and stomach pain. Now, there are two things that you can really do to manage those side effects. One, you can eat the right foods. Oftentimes, it is not eating or eating the wrong foods that is causing nausea in these patients. And if you want to know what those right foods are, go watch my 7 foods video, because that will give you a whole bunch more information. Now, the other thing that you can do to manage your nausea is to start at a low dose and move up to that therapeutic dose at an appropriate cadence. Again, if you think you have to jump right into the highest dose because you're only planning on being on the medication for a few months, or you can only afford the medication for a few months, then you are probably going to feel terrible and then go right back to where you were at the start. Now, your doctor can also prescribe you an anti-nausea medication while you are taking these weight loss medications. However, I have seen disruptions in Zofran, which is the most common anti-nausea medication, because so many folks are now trying these weight loss medications and just experiencing more nausea. Now, when it comes to supply and cost of things like Ozempic and Wegovy, things are getting interesting at this moment in time. So once these prescriptions really started to take off, the demand outpaced the supply of the FDA-approved drug. So compounding and online pharmacies started to make dupes. However, in June of 2025, when I am recording this, Novo Nordisk, which is the pharmaceutical company that produces Ozempic and Wegovy, sued to get those dupes off the market. So these online pharmacies like Hims and Hers, they are no longer able to produce those lower cost drugs. Now, this means that access to these lower price drugs is essentially going to come to an end. Now, without insurance coverage, these medications are over $1,000 a month. They run between $10,000 and $16,000 for a year supply. And each brand of these weight loss medications is only approved for certain conditions. So just because you qualify for one medication or another does not necessarily mean that that is the medication that your insurance company is going to cover. So if you get on one of these medications, if you qualify for one of these medications, there is no guarantee that you are going to be able to afford it. And that could mean that not paying for these medications for just a few months is going to be better for your wallet, and maybe therefore you can invest in some other things that are going to help you be more successful in a lifestyle weight loss intervention. That money can maybe go towards paying a personal trainer, paying a registered dietitian to give you some accountability on these lifestyle programs. And both of those things, hiring a coach in some capacity, has been shown to be more effective on the lifestyle side and the medication side. So if you are actually needing to lose that 15 to 20% of your body weight to manage a chronic condition, you might actually qualify for something like gastric bypass surgery. And it might be worth having a conversation with your doctor and your insurance company about what they will cover and what is most appropriate for you. All right, so tip number 3 is to build muscle. I recommend that everyone build muscle to reduce their risk of chronic disease. But for folks who are taking weight loss medications, it is incredibly important to be working on resistance and strength training while they are losing weight. Otherwise, we are in danger of losing the skeletal muscle mass and the heart muscle mass that can actually help us stay healthy after we come off these medications if we do need to. One thing we know from existing science is that people with more muscle mass burn more calories at any age and at any weight than their peers who are the same age, the same weight, but that weight is made up of less muscle mass. So if our goal is not to regain weight once we come off of the medication, we are going to want to have more muscle mass and therefore have a bigger calorie budget that we can eat without seeing weight gain. When you come off of the medication, your higher appetite levels and maybe that food noise, your thoughts about food, that's going to come back to some extent. And so if you have a bigger calorie budget, that can keep you in a calorie balance, and that is just going to be more effective. And the best way that we know to do that is to have more muscle mass. You need to be engaging in progressive strength training exercise. So strength training exercise is any type of exercise that causes your muscles to work against force or weight. We typically think of weightlifting. Now, progressive strength training or progressive overload refers to the idea that over time, so maybe week over week or month over month, you actually need to be adding more weight, more intensity, more time under tension to this strength training exercise. So if you are not currently doing a lot of resistance training, you may be able to start with body weight exercises and start to develop more muscle and more strength. But over time, you are going to get used to your body weight, and also your body weight is going to be going down. So in order to maintain a progressive strength training plan, over time, you will probably have to progress to using some sort of weight or resistance. That could be barbells, dumbbells, kettlebells, sandbags, weight vests. It could be the machines at the gym, to some extent, maybe water, swimming or water walking, right? There's going to be some resistance there more so than walking through air. These are all great options. And you may need to play around with a few different styles of resistance exercise to find the one that you enjoy enough to do it regularly. Maybe it's just finding the one that you hate the least, but it is incredibly important for both muscle and bone health to be engaging in resistance exercise training. Now, last reminder here, if you consistently carry around a purse, a backpack, a briefcase, a baby, that is weight that you are typically carrying around. And so to achieve progressive overload above your normal amount of resistance training that you're doing, your weights are going to need to be heavier than that purse, that backpack, that baby. Now, tip number 4 is to change your dietary pattern. One thing we know is that people who eat a lot of fruits and vegetables, a good amount of protein, 25 to 35 grams of fiber per day, and most of their fat is coming from plant and fish sources, they tend to eat fewer calories but feel satiated than people who are eating diets that are lower in fruits and vegetables, lower in whole grains and fiber. The fats that they're eating are mostly coming from like red meats or processed foods. So that is a good place to start. If your diet doesn't already look like that or didn't look like that before you started taking one of these medications, you are going to want to shift what you are eating towards, that more fruit and vegetables, lean meats, and healthy plant-based fats for the most part, because that is going to help with the feeling full and getting fewer calories. That is going to help you maintain energy balance or even an energy deficit, even coming off of the weight loss medication. We also know that one of the mechanisms of Ozempic, Wegovy, tirzepatide, semaglutide medications is to slow down digestion. Now, there are some ways that we can slow down our digestion even without these weight loss medications. It's not quite to the same degree, but it can be useful to maintain the weight loss that we had on these medications. So fiber or whole grains, protein, and fats, they empty from the stomach slower than things like refined grains, than candy, sugar, liquids, soda, things like that. So that is another reason to shift our dietary pattern to eating more whole grains, to eating more fruits and vegetables, because those things have fiber that will slow down your carbohydrate digestion. We want to prioritize protein because, again, it digests a little bit more slowly, and we want to make sure that we're getting enough fat in our diet because it slows everything down, similar to how semaglutide or Ozempic medications are going to slow things down. I also recommend eating more balanced meals and snacks. So pairing your carbohydrates, which tend to digest more quickly, with a protein or with a fat, so we can achieve that slowdown to mimic what is happening with the weight loss medication. Of course, you are still going to achieve weight loss if you continue to eat the same foods that you were eating before, but in smaller portion sizes. But when you come off of that weight loss medication, you won't have changed what is your normal or what are your go-to foods. And that food noise and your appetite is going to come back when you come off of the medication. And if you are still used to eating, refined carbohydrates, not a lot of fruits and vegetables, your appetite and your intake is going to look like it did before you started taking the medication. And that is going to contribute to the weight coming back. Also, if you are not being thoughtful about the fruits, the vegetables, the lean proteins while you're taking these medications, you may end up being one of those folks who develop some sort of deficiency because you're not getting enough of the vitamins and minerals that you need while you're not eating very much. And that can be just as detrimental, if not more, for your health than being overweight. Now, if you need ideas or you need suggestions, including what to eat at some fast food restaurants, some no-cook ideas, even some dessert ideas, I have all of those in my free weight loss medication ebook, which I will link down in the description of this video. I also have a free fiber ebook that might be useful as you are coming off of these medications to ensure that you are getting enough of those slower carbohydrates in your diet as opposed to, those refined carbs. My last tip is to address those non-food and non-exercise specific conditions that led to your weight gain in the first place. I do not at all mean this as a way to shame you. Life is hard and very expensive. Western civilization and capitalism and the American healthcare system is not conducive to good health. There are a lot of barriers built into our society that are keeping you from being healthy. Can we figure out what your barriers are specifically and address them while you are taking the weight loss medications so that when you come off the medications, you don't have the same challenges as you did before? Now, if you are one of the millions of people who struggle with knowing what is healthy, what should I be eating, how should I be exercising, if knowledge is your barrier, then I would really love if you would subscribe to this channel, because the whole goal of this project is to provide easy to implement, easy to understand, evidence-based nutrition education without the time commitment or the cost of seeing a dietitian in their office. If one of your barriers is limited access to healthy foods, I encourage you to find the resources in your community that can help provide support for paying for groceries. That could be your local food pantry. It could be a local discount grocery store or a food recovery shop. It could be a mutual aid organization in your area, SNAP or WIC, which is formerly known as food stamps. That's what SNAP is called now. And then WIC is the Nutrition Assistance Program for women, infants, and children. Those are all good ways to cut the cost of groceries for you, and I highly recommend you use them if you qualify for them. I also highly recommend the creators Dollar Tree Dinners and Julia Pacheco here on YouTube. They have a ton of videos on how to eat well on a very small budget. Even if you just need some visuals on how to cook, those two creators have a ton of videos that are going to be useful to you. If one of your barriers is that you are super busy, you have lots of kids' activities, or you work multiple jobs, or you're in school and you have lots of homework, if you just don't have time to cook for yourself, I recommend trying out a meal delivery service. I have talked about before, but in my house, when we are super busy, we use either Factor or Cook Unity to get our dinners. Not a sponsored video, but I do have a discount code for each of those platforms down in the description. Now, if food is part of your emotional regulation toolkit, if you feel like you are oftentimes stress eating, anxiety eating, emotional eating, then I really encourage you to connect with a therapist, work through any trauma you've experienced, and develop some other coping mechanisms. So you don't just fall back into old patterns if you do get off of these weight loss medications. So to wrap this one up, my 5 tips for maximizing and maintaining the weight loss that you experience while taking something like Ozempic or Mounjaro are to, 1, understand going in that this is a long-term commitment to medication and plan to be on Ozempic, Mounjaro for at least 2 years. My second tip is to manage the costs and manage the symptoms or side effects of taking these medications, because those are the 2 main things that are going to help you achieve number 1, staying on the medication for the necessary amount of time. Number 3, build muscle mass, get stronger. It is going to reduce your risk of developing chronic diseases over time. It is also just going to increase your calorie expenditure budget on a daily basis, which means you will be able to eat more without gaining weight. And that is hugely important when you are trying to maintain weight loss through any means. My next tip is to change your normal diet. I didn't talk about it a lot in this video, but this is something that I went through when I was in my late 20s and early 30s. I did not eat a green vegetable until I was like 24 years old. I ate 2 bags of candy almost every night when I came home from CrossFit. It took time, but I have now changed my dietary pattern. I eat vegetables regularly. I eat more blueberries than candy. So it can be done, and I recommend that you use the time on the weight loss medication to actually do that shift in your regular dietary pattern rather than just eating smaller versions of the same foods that you always eat. And my last tip to maintain and maximize your weight loss medication experience is to take some time and address those other factors that originally led you to weight gain. So if this video was helpful to you, I would so appreciate if you gave it a thumbs up. That really helps the YouTube robots understand that it was a good video, you learned something from it, and show it to more people like you. If you have any questions about weight loss meds or other chronic diseases, feel free to leave those in the comments. And as always, thank you so much for being here. This is actually my last video in my series on weight loss medications. I highly suggest you start at the beginning of the series where I explain how these medications really work to create weight loss, to lower blood sugar, to improve cardiovascular health, and reduce the risk of other conditions like sleep apnea and PCOS. Many people taking weight loss medications like Ozempic, Wegovy, and Mounjaro are actually not eating enough vitamins, minerals, and other essential nutrients to stay healthy while they are taking these medications. I go in depth on that in videos 3 and 4 of the series. The 4th video, I actually give 7 foods that I recommend you prioritize while taking weight loss medications to make sure that you are getting all of the actual nutrients that you need even while you're losing weight. Now, especially if you are getting your weight loss medication from an online pharmacy where there's not a lot of follow-up, or any other setting or prescriber where you just don't feel like you have a lot of support, this is the channel for you. This is the series for you to feel like you really have all the information that you need to be successful while taking these weight loss medications.